It is no small thing. It is very significant to acknowledge publicly and state loudly what we have known for a long time, that racism is absolutely a public health crisis, both in our community and in our country. And a number of incredibly respected medical associations in the last several weeks have come out publicly to acknowledge a fact that we've known for a long time. The American Public Health Association, the Academy of Pediatrics and American Medical Association, the American College of Physicians, the American Academy of Family Physicians, and the American Psychological Association. Public health, for it to really work, needs to include important elements of medical, mental, social, economic, and educational components. All of them are intertwined. All of them are connected. You can't successfully have one without the other, and all of them are eroded by structural racism. The barriers in our healthcare system often prevent people of color from accessing necessary care due to cost, language, access, and yes, discrimination. Black and Latino people suffer disproportionately, living in densely populated urban areas with less access to green space, substandard crowded housing, and without the luxury of self-isolation, which has proven to have catastrophic impacts during this pandemic. They're relying on public transportation to be able to access the basic needs that all of us, many of us, take for granted, is something that is a critically important component for us to be able to address this moving forward. And to combat racism as a public health issue, we need to address the causes and not the symptoms. And we can't expect people who are disproportionately impacted by this structural racism to continue to adjust to that structure. We must rebuild, relook at, and completely redo the systems that have led to the structural racism that so many have been experiencing for too long. And so, as the chair of the Health and Human Services Committee, and each one of us in all of the committees that we work on, I know are going to continue to make this a priority. I'm proud to have worked with my colleagues over the last 2 years, and proud that we have set up a construct that lays the path for us to be able to move forward. But we must also acknowledge that no one program, policy, person, or initiative is going to address this completely. And it will, unfortunately, take time. But I am completely committed to ensuring the work of our committee will focus on those public health disparities. Because not only does it tragically impact those most disproportionately impacted and literally lead to life or death moments that are unnecessary and tragic, but this is a public health issue that impacts the entire community and something that all of us need to focus on. It's not just a moral obligation for us to be focusing on these issues right now, it's also a public health imperative for everyone moving forward. It's ironic and also tragic that the pandemic and the virus, and then the tragic elements that we've all been protesting against of police brutality, have come together at the same time. It right there before our very eyes, we're seeing the devastating and life or death impacts of this structural racism and the construct that we have before us. We're sometimes numb to the statistics, but the fact that our minority communities, and in particular our Black community, is so disproportionately impacted by these structures, we can't continue to focus on this individually. It has to be a systemic approach. And so in very short period of time, we will be working directly with our colleagues in the Department of Health and Human Services and Dr. Raymond Crowell, and we'll be also working with Dr. Gales and our public health officers to comprehensively look at every single aspect of our public health infrastructure here in Montgomery County and how it is impacting our communities as a whole. We know that working collaboratively with our private sector, on our profit sector, and our public sector, we will be able to make more progress than we have been making up until now. And we'll be able to, I believe, put us in a much stronger position. This has been an extraordinarily emotional time, but one that I believe is going to make us stronger. And I have such respect and confidence in my colleagues on this body. I have enjoyed working with you over the last 2 years and very much look forward to working with you these next two to ensure that we continue a positive path forward. And I want to thank all of our county residents who have come forward and demanded to have their voices heard. You are being heard. And I just am proud of how we are going to step forward collectively as a body and know that much work needs to be done. Thank you, Mr. President, and I look forward to working with all of my colleagues to move us forward as a community.